Awesome. Well, first of all, I just want to thank James and Lucia for the invitation to T1 International for us to speak and share more about this win, and just this like monumental decision that we had in this community. And I think it's really something to acknowledge that this was a massive community effort, and there were so many of you who contributed to every step of this process, and that collaboration highlights the power that we have when we come together with a common goal. And we always say it to an international that the voices of many are strong and powerful. And so I don't want us to forget that as we continue to face challenges and barriers in this field and advocacy and in our own individual journeys. So I'm just going to give a bit of background about how we came to write the application and then just kind of the impacts that the essential medicine list has specifically with insulin. So I first started working for T1 International last October. And it was the end of my first week. The founder, Liz, and executive director, Shayna, asked me if I would be interested in supporting our application. And I immediately jumped on it. They warned me that it wasn't a very complete application, more of a structure, as they had started it back in April of 2024 and were really looking to collaborate with folks to make sure that each section was, completed properly and that we had enough evidence to support our claims, and just didn't really have anyone wanting to take on that really big task. And so the three of us agreed that it was something very important. It aligned with our goals and missions and values. And so for 3 weeks, I was reading and writing and rereading. And it was a big take on, but I had a lot of people helping along the way. So one of my dear friends from my master's program helped with like the cost benefit section. We had Marlene, who's a clinician, help with the clinical evaluation. And then Liz and Shayna provided endless proofreading and editing, especially when I could not stare at a screen any longer. And so just like that, the application was written, polished to the best of our abilities, and submitted at the beginning of November. And then it was just a very long waiting game. And so in February of 25 of this year, we then received approval that the application had made it to the next round, and that it was time to start our EML mobilization. And so this mobilization we created was like a 5-part series that had also a webinar, and it just gave more context and background to the essential medicines list. And then we also had focus on training our global advocates how to write support letters to the World Health Organization, how to share their story through video and social media. And so, huge thank you to some of the folks on this call who took part in that, and also to the 35 people who helped write comments, then sent them in for support, and then also the hundreds of signatures that were on our petition. And so I got to speak at the Essential Medicines List open session in Geneva of this year, and deliver the petition and really just state that this is far more of a patient's choice thing, and that it needs to be recognized. And so it was a successful delivery in May, but then it was also back to the waiting game for the ultimate decision. And so in the meantime, we did a lot of sharing on our social media. We still had a lot of folks helping us in collaboration, spreading the word. And we were really prepared for either outcome, because at that point it just felt very 50-50. I was probably a bit too optimistic because I had put so much work into it, but I think for good reason, because then one morning I woke up and there was hundreds of messages and emails that our application had been accepted, and that rapid acting insulin analogs were added to the list. And I was both very, very shocked and also just immensely proud and impressed by our community and all the voices that had come together to make this a reality. And we might not have legislative power as people with diabetes, but we do have such a strong power that can make widespread lasting change nonetheless. And so just a few things about our application. It was 87 pages. We collected over 1,000 petition signatures from around the world. We had 35 letters, really strong letters as well, both from a patient advocacy side and from a research side that was supporting our application, and then lots of patient stories that helped support as well. And so the big impacts of getting a medicine onto this list is that it's not a list that is required for countries to implement, but 137 countries do follow this list and try and maintain those medicines in their national registry. And some big points of why it does matter is that over time it drives price reductions through global pressure and negotiations. This happened when long-acting insulin analogues were added back in 2021. It also had happened with some cancer and heart disease medications as well. Next, it enables access in low and middle income countries. It supports legal and policy reforms to improve availability. It can guide national health systems on medicine and health priorities. And then it also encourages generic production, local manufacturing, and it really strengthens advocacy efforts on equitable access. And so one of our main lines that we were telling people is that everyone, no matter where they live, should have access to the best available treatment and the treatment that best helps them manage their diabetes. So geography should not affect what type of medication you have access to, what type of insulin you're allowed to use. It shouldn't matter where in the world you're at. Everyone should have right and equitable access. And so that's a big part of why we wanted to get this on there. And we're so incredibly thankful to all the folks who supported us and shared their stories, wrote letters, reposted on social media. Every little bit helped along the way and just really showed the world that people with diabetes are powerful and we're going to show up in these spaces. So this victory is for all of us, by all of us. So thank you very much.